to the show. Today we have a special guest visiting us, Dr. Adam Solis. So, Adam, we met through a networking group, which was very interesting, and I've come to see Adam for some back stuff that I was dealing with as well because I was looking for a chiropractor. So, can you tell us a little bit about yourself?
Yeah, so, well, first off, thanks for having me here. This is fun. I always love these kinds of opportunities, whether it's a podcast or a video, so really appreciate it. About myself, we're talking as a chiropractor or
Yeah.
individual. I guess we'll start. Well, I was in school for about 9 years in total to get my doctorate and be licensed here in Ontario, Oakville, right? And I've been practicing. I've had my license for about 3 years now. It feels way longer than that. I've been running my own shop for almost two, so seen a whole variety of different cases since opening up, and not just back, mostly back, but not just back. Yeah, that's a brief little summary of career so far.
Very nice. Now, looking into your background, it says that you are a diversified or
Mhm.
use a diversified technique. Can you tell us a little bit more about what that means?
Of course, yeah. So I feel like one of the great things about my profession and the licensure is that there is a lot of variety and a lot of leeway and play that you can take with the chiropractic license. You have scope to treat pretty much any kind of what's referred to what falls underneath the neuromuscular skeletal umbrella, meaning conditions of the nervous system, conditions of the muscular system, the skeletal system. And now, this idea of diversified technique kind of stems from the idea that multidisciplinary care or being seen by people who specialize in different disciplines is almost always superior to single professional
Mhm.
care. I don't think that's the right word for that, but still. And there's lots of research to support this in every different field of medicine. That's cardiology, nephrology, neurology, everything. It's almost common sense at
Mhm.
this point. Of course, me being an individual, it's not actually possible to provide multidisciplinary care as a sole individual, but diversified care is the idea of pulling the techniques from different disciplines as a sole individual, right? So, for example, here as a chiropractor, yes, but as a diversified chiropractor, I'm readily doing a lot of physical therapy with my patients, which is pulled from the field of physiotherapy, obviously, right? I'm doing a lot of dry needling, which is pulled from acupuncture, a lot of massage, which is pulled from massage therapy, a lot of mobilizations, which is pulled from osteopathy, and of course, the quote unquote adjusting, the chiropractic cracking that a lot of people are familiar with, which is pulled from chiropractic, right? And the idea of that is that different conditions will obviously respond better or worse to different interventions, right? And the example I love to give people is that you don't you don't rehab a freshly injured neck. That is totally counterintuitive. And you don't crack, you don't adjust a fused spine, right? So you pick and choose the correct or most efficient interventions based off whatever the diagnosis is in front of you. In order to know that which ones are most effective, you obviously need to have the background education in it.
Mhm.
Yeah.
I was just going to take us back for a second. For those who maybe haven't actually experienced going to a chiropractor, can you just kind of give a brief idea of what that is for people who haven't experienced?
That's a very easy question with a complicated answer because again, there's a lot of diversity. Some people will go to a chiropractor and they're basically treated by a physiotherapist. It's the exact same thing. You're going through exercises, maybe some soft tissue work. Some
Mhm.
people go to a chiropractor and they'll get absolutely everything on their. So I use the term adjust and cracking a little bit interchangeably. A lot of people, we're trying to move away from the term cracking because it sounds kind of unprofessional, but that's if you've ever quote unquote cracked your knuckles, like that's what chiropractors can do for pretty much every joint in your body. And it's a very effective method for things like pain relief, all right, which is obviously on the forefront of your mind when you are in acute pain.
Yes.
So there's a lot of variety in what you can expect depending on the chiropractor you go see. Some will treat you like a full-on, we're only doing exercise, almost personal trainer approach,
Hmm.
and then others are just the will only do the adjusting. So traditionally, more chiropractors will adjust than treat in this physical therapy manner, but that's what you could probably expect in seeing one.
Amazing. When I came to see you,
Mhm.
I came in with kind of acute stuff going on. Like my back
Mhm.
was completely seized up. And I remember like some adjustment did happen, but you did a
Mhm.
lot of other things as well. Can you explain
Mhm.
how you use other like osteopathy and other
Of course.
techniques to help people?
Yeah. Yeah, so you're actually a prime example. Are you okay if I kind of share like specifics
Sure.
about what it was that we did? Okay, perfect. So, with your consent,
Mhm.
you came in with like a lot of upper back seizing almost, right? And like you were having trouble breathing even. It was tough to rotate, which is pretty standard part of the course for things that I see on a day-to-day basis, right? Um, Now within the upper back, we have a whole bunch of tissues. Okay, actually within our whole body, we have a whole bunch of tissues. We have muscle, we have joint, we have cartilage, we have ligament, we have bone, we have everything. We're never just one thing. Okay, so in an upper back, for example, from the musculoskeletal perspective, we have muscle, we have joint capsule, we've got some cartilage, we've got bone, we have all of that. So it makes sense to me, at least, if somebody's coming in seized up in that area, that you would want to use interventions to check off each tissue and make sure that each separate unique tissue has been addressed, right? So for example, let's start with the chiro, the adjusting, right? Adjusting is really good for pain relief of the joint structures themselves, because that's what you're actually opening up, gapping, hence the popping sound that is the targeting and opening of the joints. But as far as muscle goes, it does have some effect on it, but it's not as effective as having a massage, for example, when it comes to working those muscles. So in that case, I think we did do massage work with you, if I remember correctly,
Mhm.
to try to calm down those paraspinal muscles alongside the spine, which did not want to let go. And that was part of the reason why you're having trouble getting a full breath in. And then there's the fascial tissue too, which I haven't even touched on. Fascia is this connective tissue. It kind of like I describe it to patients as saran wrap that kind of clings and encapsulates everything that helps everything to slide against each other really nicely in a frictionless environment. A lot of practitioners completely ignore the importance of that, right? So we did a lot of fascial work in the form of instrument-assisted soft tissue therapy to free that up. And I like to think that you were feeling a lot better afterwards because you told me, hey, I'm feeling a lot better after this. So I think that combination approach and really focusing each unique tissue that's present is better than only focusing on one and calling it a day. I feel like that's pretty common sense to me and is to most other people when I explain it that way.
I'm pretty sure my words directly were, I can breathe again.
Oh,
Thank
even
you.
better.
That was the message that I sent you afterwards. And yeah,
That's
it was nice to not just because I've gone to chiropractors in the past where it was like, oh, we're trying to force your back to crack, and my body goes into like eek and holds
yeah.
on so tight that things won't release and let go. So yeah, you used some silver metal scrapey
Mhm.
thing and did a whole bunch of stuff.
Yeah, this guy right here, I haven't cleaned them since the last patient, but yeah. No, and that was I remember that was it. You told me that if a chiro just goes in and tries to do it, like nothing happens really with you because you're too guarded. So the intent with your unique patient case was to calm everything else down first, work on all the other more external, more extrinsic, excuse me, tissues, and then try for the joint structures. And it worked phenomenally. Like we got pretty much everything to go in your back, and you could breathe again, as you said, right? So.
You're obviously you deal with people who I'm sure have been in a car accident or
Oh
something
yeah.
more acute if you're dealing with someone who's in the sports world or something like
Mhm.
that. Why would some what are the other reasons that people would come to see you?
So
Non-acute.
yeah,
Not
so
acute,
acute
yes.
pain is the obvious one, right? But beyond acute, you'll get a bunch of people who are just dealing kind of with quality of life issues, for
Mhm.
example, right? Like, oh, I had a guy come in the other day, bigger man, having trouble with his kind of shoulder mobility, right?
Mhm.
He wasn't able to get his arms behind his back anymore. He was having trouble reaching up for the higher, the cookware or whatever that was high up on the shelves, right? And that decrease in ability can obviously be kind of concerning when it's the first time you've been experiencing these things. I mean, you've been functional, everybody's functional in their life up until they're suddenly starting to lose it. And then they realize, oh, well, I want to be able to reach the top shelf. I want to be able to go up the stairs, right? And a lot of those things can be due to, either deconditioning if you're not a particularly active individual. In that case,
Mhm.
comes the lifestyle advice and the physical therapy component to bring that back. And then also a mobility piece too. So a lot of shoulder issues, just for this, because I'm talking about this one individual, can come from stiffness of the thoracic spine. So showing the patient how to properly stretch that out through dynamic stretching, not just static stretching, because one has been found to be more effective than the other.
Mhm.
Pain is the obvious one, but a lot of people will come to a chiropractor for quality of life issues that have nothing to do with pain, but just, hey, I can no longer I can no longer climb the stairs comfortably at night, or it hurts when I wake up in the morning and I'm moving 10 years older than I actually am. So that's those are the two biggest demographics that will present to a chiropractor typically, and that present to me.
Amazing. What's the age demographic that comes to you mostly for the preventative side of things?
Mhm. That's tougher to say because it depends largely on where a patient's kind of values are. Some people are
Hmm.
very, very reactive when it comes to their health. And I mean that I think I just kind of described the Canadian healthcare system. Things are mostly like, oh, you have this condition, now we treat it versus um let's make sure you don't get conditioned in the first place. Now that I should give credit where credit's due, there is an emerging branch of something referred to as lifestyle medicine. A lot of family doctors moving more the proactive way, which I love to see. That's phenomenal. I met with one, I think, the other week who was talking about what was it? It was not narcolepsy. What's the opposite of narcolepsy when you can't? Insomnia. That's it. And it was great to see, a medical professional take the perspective of how can we prevent these things from happening rather than treating them afterwards. But it's really tough to give an approximate age demographic. It's usually after somebody has had a health scare or somebody close to them has had a health scare that they suddenly take a much more serious approach to being proactive and making sure these things don't happen. There's also a huge upswing in interest about being preventative kind of during the pandemic as well. That's when a lot of patients, especially as we were coming out of it, started to take their health a lot more seriously. And I feel like the importance of it was definitely on the forefront of everybody's mind. But specific age, couldn't tell you. Really depends on when things happen in their life, right?
Amazing. I think always is a good age. Like there is no
Yeah.
age that's
I
too
agree. I
young.
completely agree. Yeah.
But there are so many times it's like anything. It's like your car. When do you take your car to the mechanic, or when do you take something in to get serviced when there's a problem? And if you deal
You
with things before there's a problem, you're
exactly,
going to
exactly.
have
You'll
less.
have people bring their car in when they're told they're supposed to, like I do, and then have people who wait until every single light is on to take it in, right? And it's just there's just two kinds of people, unfortunately. But that's the way that it is with our health too, it seems.
Yeah, gaslight on, or are you actually filling it up before it gets to that point?
Exactly.
That's a fun conversation.
Yeah.
Just to switch it up a little bit, because there's so many chiropractors out there.
Yes, there's tons. There's 10 on the
How,
clock.
if I was coming to see you, how do I know that you're a right fit for me? What are the things people could look for?
Yeah, so it's a great one because again, there's that variety. So you kind of it's tough if you just go pick and choose at random. It's actually quite
Mhm.
unlikely that you'll find a chiro that you uh, kind of click with and you feel is right for you. You could obviously shop around, go do consults. I find it's much more effective to ask a friend. Okay, like I think last there was an Ipsos survey held by the Ontario Chiropractic Association in 2019, just 1 year before the pandemic, and I think the statement was 27% of Ontarians see a chiropractor at least annually, right? So there's a chance. Do you know three people? Yeah, okay, then there's a chance that one of them sees a chiropractor. If not yourself, ask them for their recommendations and what it is they like about them. Failing that, there's always Google reviews. Okay, there's going to be
Mhm.
people who are leaving reviews and read them, not just the ones that are 5 stars, but read the 1 star reviews too. Like get an idea of both the high positives and the low negatives. If a 1 star review has more to do with perhaps poor customer service with the receptionist, well, is that really reflective of the chiro or is that reflective of maybe an employee staffing issue? Point is, read, okay, do a little bit of research. Failing all of that, what I've done specifically to try to help a lot of people at least find me and decide whether or not I'm a fit is I mean, I started my YouTube channel, right? And
Mhm.
I wanted to do this because I mean, metrics show that video is the most effective form of advertising, first off.
Yep.
And I film full-on treatments, uncensored, totally real and done in the moment. I don't know anything about the patient beforehand, and then put that online and have somebody witness that, watch that. And right then, before they've even talked to me, they can kind of decide based off treatment style, okay, this person is a good fit. I really think that social media as a whole should be seen as a potential positive for chiros, and that we should really, not just chiros, I feel like most practitioners, most healthcare people could benefit strongly from it. And that's with you guys doing the podcast too. In my opinion, I think that's a brilliant idea.
Mhm.
Um, Giving that preview and providing that value before the patient has even picked up the phone to call you or even Googled you online is a great way to help make their job of identifying you and locating you way, way easier. So if there are healthcare practitioners listening to this, I highly recommend you involve in at least some kind of video media showing what it is that you do, whether that's one video that's hyperlinked on your site or you start a whole channel yourself, right? But like or an Instagram Reels too. One or the other,
Mhm.
pick one, because otherwise people are going to have trouble locating and then choosing you.
Mhm.
Yeah. It's a really big part of feeling like people can get to know you a little bit.
Mhm.
And like you
Mhm.
said, yes, you can see full out on your YouTube channel what a treatment looks like, what your style is, what your approach is, how you
Exactly.
address a new person, which is really cool to see. Like, how do you assess a person's overall health and wellness during an initial consultation? Can you share a little bit about that?
Yeah, so I mean, at this point, it's become kind of so simple because it's just a conversation, right? And it's a conversation asking questions that people aren't necessarily really asked by anybody else they go see, right?
Mhm.
When you go to the doctor, typically you're going in there for a reason, all right? I mean, yes, I think there's the semi-annual checkups every 2 years now. I think they pushed it back, they extended it, but those are pretty generic. But usually when you go see your family doctor, it's because you're having a standalone issue. Oh, this hurts. I want this addressed. When you're doing a more full assessment than just one issue. You're asking about everything. You're asking about lifestyle. You're asking about their goals, what it is they want to do, and what's stopping them from, excuse me, I just said excuse me to my desk. What's stopping them from reaching their goals, things like that. So obviously, yes, when people come see a chiropractor, the most frequent reason is for that acute pain, and you're going to do a full orthopedic exam of that, a full history taking of that, what caused it, what makes it worse, what makes it better. But then, especially as they start to improve, you want to find out more about that individual and more about how, chiropractors, or myself in this case, can help them get to whatever goal they're trying to reach. Specifically for me, again, I keep talking about goals. I treat a lot of athletes. So a lot of them are saying,
Mhm.
oh, I want to lift heavier. Oh, I want to, run faster, whatever it is. And from there, you can guide them through at least the biomechanical component of that. If they want to run faster, what do they got to do? They got to get stronger legs. How do you do that? Well, we got to make sure your squat mechanics are strong, right?
Mhm.
So does that answer your question there? I feel like I got sidetracked with that one.
Yeah, no, that was good. It was really good information.
Mm,
And how do you assess people from the beginning? And yeah, I like how you said that. We'll touch a little bit, whatever, I'm going to talk about it now.
mm,
So how do what are you assessing like everyday life stuff? We are sitting at desks right now.
mm.
And so many people, that's a big part of their life now,
Yeah.
especially post Amanda standing up. I'm sitting at a desk.
Ah, she's
Especially
smart. Yeah.
post pandemic, a lot of people are seated all day long and how that impacts their daily life. Do you give people things that they can do to help navigate so that that doesn't become as much of a problem?
Yeah, so this is always a fun one because I have this conversation every single day because again, sitting it's a part of our life. It's here to stay. Some people say it's the new smoking. I think that's a little dramatic. But yeah,
It's needed.
especially during the pandemic, everybody moved to working from home. Sitting went way up, and at least personally, it's not like we have metrics or anything, but personally, I found that I saw a lot more people who just had to do with kind of sedentary injury, right? Or
Mhm.
insufficiency injury, just sitting all day, primarily that upper back, the neck region. But as for what to do for that, a lot of people this posture gets demonized, right? Like the slouching forward, the traditional typing. That's a bad posture. A lot of people say that, okay? And this conversely is the good posture. Shoulders back, elbows
Mhm.
at 90, screen at eye level. And to a degree, that's true. But the only reason that that's true is because this posture is the one that we all naturally default to and then remain within for too long. Okay.
Hmm.
Um, New research on the concept of postures found that it doesn't have to do so much with any one posture, but more with how long it is you're remaining within that posture. So the people who get that neck and upper back pain from sitting at a desk too long, it's because they're like this the whole time. It doesn't have to do with the fact that they're like this. If they had that perfect posture that everybody loves the whole time, they would still develop pains and stiffnesses in relation to this posture. It would be different, obviously, than the ones you get like
Mhm.
this, but they would still happen. So
Hmm.
the more important aspect is to consistently change the posture while seated. Now, that's easier said than done, all right? Because when you're working, you get caught up in a state of flow.
Mhm.
You're not gonna pull yourself out of that, go, oh, I gotta move, and then change your posture. So I actually recommend an app to my patients instead
Hmm.
that serves as a reminder, a check-in every 25 minutes. It lets out a very gentle, importantly, non-intrusive chime. And then also recommends a double check 5 minutes after that, we'll chime again to ensure that you maintain that change in posture. And that's important because obviously if you're like this, then you change back to this. If you go right back to where you were, congratulations, you've done nothing. Right. So that double check, I find it to be very effective. The patients who I give this app to, it's called Focus Keeper. I'm not affiliated with it in any way. I just think it does a really good job with this. They swear by it. They say that it's solved their headaches, it's solved their upper back pain, it's solved their neck pain, all because it has successfully made the unconscious conscious without interrupting your workflow. So highly recommend that. Focus Keeper, Google Play, App Store. It's a little grapefruit. I'm obsessed with this thing. I love this thing. Yeah.
And something as simple as that, just having that reminder to keep moving so you don't have that headache can be life-changing for your day.
Absolutely. Absolutely. It can be. People underestimate the benefits that can come with something as simple as a quick little change like this and holding that for the next 20 minutes. That's it.
Yeah. As far as, because you're doing various techniques for people, the mind body component, obviously with doing, where's my words here? You do acupuncture. I'm sure you believe that everything is connected. And then having the mental health aspect of it. How does coming to see you affect people with their mental health? Like what is the overall?
Yeah. So, I mean, to answer that question, we kind of do. So chiropractors and to a degree, physical therapists and osteopaths and RMGs, we are all manual therapists, okay? Which means that what we all have in common is ultimately we will all probably at some point put our hands on the patient, okay? And with that, we really do have to talk about like the power of touch, okay? Just simply touching a patient or having your hands on someone can, in some cases, be considered an intervention. All right. And that's because with the connection of skin to skin, you get the release of oxytocin, you get that whole hormonal cascade that can calm down your stress levels and bring you back to a baseline of feeling okay. All right. There are lots of patients in here who come in because they like the feeling of being touched. That's true. All right. And here it's a way to relieve those stresses simply by being touched. Totally non-pharmacological. It's very, very powerful, and people underestimate that.
I'm sure that was big after the pandemic as well, when people were so
Oh,
isolated.
Oh my good. The number of patients during the pandemic who would come in and tell me, Adam, you are the only person I see because they live alone, right? Like think of like a senior man or a senior woman, widower whose grandkids have moved away across the country, right? The number of those people was very, very alarming and quite heartbreaking, if I'm being totally transparent. But, in those moments where have your hands on their back or you're holding your head in their hands. I've had people just kind of start crying, right? And it's very humbling, it's very emotional, and I'm very fortunate to be in that position that I could provide that to someone. But mental health is everything, right? Like if you take two people, all right, who are consistent across the board and the same in every way, but you make one have terrible mental health, they will also develop a bunch of physical pains and problems as a result. All right. So it can't be understated just how important it is to focus on your own mental health. And again, I am not necessarily a mental health professional. You should go consult with somebody who does specialize in that stuff. But the power of touch can be greatly beneficial if you are looking to improve upon your own mental health.
Even at that, the fact that you're asking questions that other practitioners are not and listening to them and what their needs are, that in itself is huge.
Being heard too. That's another power that I didn't even touch on. That's great. I love that you picked that up too. Yeah.
We're holistic too, right? And it's so much more than just the physical person. There's so many things that impact our everything, our
So
body
true.
as well. Okay, so I'm going to take a little bit different direction
Of
for a
course.
minute. What are some common misconceptions about chiropractic care that you could address?
Common misconceptions about chiropractic care. Do you have any in mind? That's that because like see me as a chiropractor, like I feel like I know about chiros, right? And I get some questions every now and then, but do you have any questions in particular?
Is there anything people come in that they're worried about or expecting, and then you're able to put them at ease?
Okay. So a good one would be okay, the adjusting, the cracking. It can be quite scary for some
Hmm.
people if they've never had it done before. I mean, you go you go to Hollywood, you go to the movie theaters and you watch like an action flick, okay? You'll see like James Bond or Jason Bourne or like Black Widow
Mhm.
or someone kind of grab somebody around the head and boom, right? Like crack their neck in that way and suddenly they're dead, right? That's
Yeah.
to a lot of people that is actually their first exposure to getting a neck, quote unquote, cracked or adjusted. And one of the common misconceptions I have to clear up for people is that that's actually very, very, very difficult to do, and you
Hmm.
have to be trying to do it. All right. So that's the movements that are done in here. I do adjust necks every single day. I adjusted necks this morning. The movements that you do or a chiropractor will do with you are very, very gentle compared to anything you've ever seen before, and just in general. So I have adjusted most patients that come in this office. I've hurt none of them through the adjusting. So if that means anything, I've seen thousands of individuals. I worked at a clinic with two previous practitioners who had been practicing over 40 years each. And again, I don't think that they definitely had some adverse events, but I
Hmm.
can't imagine that they've caused significant harm in any of them because the movements we do are so minuscule and they're so gentle compared to
Mhm.
what you're probably expecting them to be. Um, Chiro is a very safe profession that some people just have misconceptions about. So that's probably the most common one for certain.
Nice. Are there any success stories that you want to share as far as how you've helped someone from?
Oh man, success stories. Okay, there's a lot. I'm trying to think of let me look back, see if there's any. Okay, there's one woman who this would have been about a year and a half ago, I think, who was suffering with migraines and getting at least two migraines a week. Okay, and if
Mhm.
nobody's had a migraine before listening to this, think of a headache, but then multiply it by about 100. Okay, that's your migraine. It's going to take you out. You're not going to be able to go to work. You're not going to be able to see your friends. You're not going to be able to be a mom, be a dad, depending on what you are. Migraines are terrible. All right. And there's also a huge, huge variety in how they present. Some people get nauseous, other people get phonophobia, which is they're triggered by sound, others light
Mhm.
phobia. They're triggered by bright lights. One patient who had migraines for the longest time. And the thing about migraines is that they confuse just about everybody in healthcare. All right. We still don't have a firm understanding of why they happen. We think it's related to something to do with their vascularity and different pro-inflammatory cytokines present within the circulatory system, but we can't say with confidence what causes them. That being said, there is a pretty good response present with migraine as well as a combination of chiro and acupuncture treatment, which is exactly what I did with this one woman, in addition to the same scraping or the soft tissue tool work that I did with you, Kate. And with that, we managed to get her migraines down to only one a month. Right now, is that a full solution? No, it's not. There's still work to be done, and we're going to keep working on it. But to go from 8 migraines a month to only one, this woman, and again, like I still keep in contact, she still comes back whenever she needs to. It's completely changed her life, right? Like now she can go to work reliably. She's a better partner to well,
Mhm.
her partner. And I'm very happy to have met her because I get happy talking about the case, for example. Again, still work to be done, but that's just one of the first ones that comes to
Yeah.
mind.
That's like
Amazing.
huge life-changing stuff for people
Mhm. And
because we've
yeah,
had clients as well. They're just locked away with having these migraines because they can't.
that's it.
Yeah.
And I should mention again with the acupuncture and the chiro, like I mean, she had tried medications before, and the medications did very little, if anything. Like her words, not mine. And this was a non-pharmacological option that hadn't been explored prior, and that worked for her. So if you can have this kind of positive effect without any kind of additional additives or any kind of pharmacology, like in my
Mhm.
opinion, that's just better. And I think most
Hmm.
people would agree with that at this point. But no, to hear like you're having similar results with what you do, that's phenomenal too, right? Migraines are absolutely disabling. So if we can do something about them, let's do it.
Yeah. And no side effects is something
Yes.
that's really nice to see as well,
That's a
right?
huge
With
benefit.
with
Yes.
anything natural.
Mhm.
You just brought up another question that I want to ask
Mhm.
you. So migraines is
Mhm.
something many people probably don't think, oh, I should go to my chiropractor for
Mhm.
that. Are there any other things that you help people with? I'm sure there's lots that
Yeah.
people don't expect chiro to help.
Yeah, so traditionally chiros are thought to be like headache and back doctors, and well, maybe even just back doctors, because headaches and migraines kind of go hand in hand. People don't often know how to differentiate between the two, but traditionally are thought of just back doctors, neck and back.
Hmm.
With kind of the modern education that chiropractors are getting these days. We are everything musculoskeletal. So that means any kind of joint on the body. We're talking shoulder, we're talking elbow, we're talking wrist, excuse me, we're talking fingers, knee, hips, ankles, foot. If it's on the body and it's in pain, there's a damn good chance that our modern chiro can do it. I use the term modern because Canada, I don't know if a lot of people know this, but Canada actually only has one chiropractic school. That's a lie. We have two. One of them speaks entirely French and only takes a cohort of about 40 people a year. So if you're like 80% of Canadians who are not fluent in French, we really only have one option, which is CMCC, which is located in Toronto, which is the one that I went to. Their educational requirements, or what they teach you rather, excuse me, is incredibly comprehensive. Okay. And they are teaching you absolutely everything about the body, not just musculoskeletal. You're also getting a full education about everything visceral too. Of course, visceral is outside of our scope. You still need to know that in order to have the doctor title, of course, so you go forward with that. But anywhere in the body can be treated by a chiropractor who's kind of received this more modern, up-to-date education, in my opinion. All right. That's that.
And so if someone's looking to work with you and get a hold of you and find out more about what you do, where's the best place they can find you?
That'd probably be through Instagram, truthfully Instagram, or you can email me, one or the other. I post daily on Insta, which means I'm checking at least daily to see if I get a message request, or my email, which I imagine would somewhere be attached to this. So perfect. Yeah. Dr. Adam C. Solis at outlook.com, just in case somebody's having trouble finding that. My name.
Perfect. We'll share everything in the show notes because I know your YouTube channel is something that very much you're active on. And I
Very
do
much, yes.
suggest everyone like check it out. He shares some
Lots of great
really
videos.
cool stuff, which is exciting. And
I
just
appreciate
like
that a lot. Yeah.
very real. It's not like really scripted and fake. It's real. And I think it's
No.
neat.
That's the one thing that I promised myself when there are a lot of YouTube chiropractors who just kind of, even in my opinion, I think they're scripted or they're done like strictly just for views. I'm doing what I do. It's authentic patients. They're people, yes, I've met them before, but I bring them in and I assess them for the first time. And I don't know anything about their conditions aside from they got pain somewhere, usually, right? Unfortunately, it's hard to message somebody on YouTube. There is no real messaging system outside of the comments. So please either email or message through Insta. That would be ideal.
Amazing. Okay, is there one key message you'd like to leave with our listeners?
One key message. Well, I would really go back to the importance of kind of being proactive in your health and making smart decisions now about who you want to be 20, 30, 40 years in the future. I know a lot of people who don't make their health their priority, and that makes me very, very sad and upset for them, truthfully, because at some point in your life, your health will be your number one priority, either because you choose for it to be or because it will demand it to be so, right? So I know plenty of people who they're not active, they don't go to their healthcare appointments, they don't take care of themselves, but they have a full family. They got young kids, they got a wife or a husband, right? Are you still going to be present in 20 years for them? And even if you are you going to be in any kind of capable shape to help take care of them, right? That's a big fear of mine personally, which is probably why I take my own health so seriously. But I also want to share with other people, like, make the decisions now that are going to set you up to be the healthy individual in 10 years from now, because nobody ever wants to be unhealthy. We just kind of slip into that very slippery and comfy slope until it's too late. So please, guys, take care of yourselves. Go see someone if you need help, a personal trainer, a nutritionist, anybody who you think could benefit you and move that needle a little bit more towards who you ultimately want to and should be for yourself and the people you love. Just do it. Please make it a priority now before it's too late.
Perfectly well said. I totally agree with that. Prevention is key and consistency with that is key as well. So just want to thank you very much for being on with us and sharing all the information that you have and how you help people. So I know there are a lot of people out there who are in pain and dealing with a lot of health issues, and they don't have to be. It's very important to know that you don't have to be dealing with these health issues. There's help out there for you. And it's just a matter of finding the right practitioner who will listen to your concerns and answer any questions you have. And if Adam speaks to you in that way, please reach out to him. We'll leave all his information in our show notes. So thank you so much for being on with us again. We really appreciate it.
Thank you for having me. It was fun. I enjoyed it.
It was great.
Great.
So I hope everyone has a great week, and we'll see you on the next episode.